Now, junior doctors have been on a 4-day walkout this week. According to a public poll by Ipsos Mori, 54% of people support doctors in their strike action.
250,000 operations and treatments may have been cancelled as a result of the 4-day walkout. Junior doctors have been accused of putting politics above patient safety, as figures showed excess deaths almost tripled after their previous strikes. Joining us now is Annabel Denham, Deputy Comment Editor of the Daily Telegraph, to discuss this. So really, was this about paying conditions, or was it all about politics and a militant infiltration of the BMA?
Well, I think the problem actually is that we cannot remove pay from politics when it comes to remuneration of NHS staff, because we don't have a functioning medical labour market. Obviously, we have a nationalised healthcare system, but we could nonetheless have some form of labour market within healthcare, which would enable us to plug shortages in certain areas and certain specialties by promising people more pay if they went into those. And the fact that we don't means that pay is persistently politicised. It also means that we have these national discussions over whether doctors deserve more pay. And you mentioned there that 54% in the Ipsos Mori poll. And I was absolutely staggered to read, that was the most recent data, that the number of people who strongly support the strike action has actually gone up in the last few weeks. Now, it'll be interesting to see if that remains the case following these latest statistics on the number of excess deaths rising during the 2 weeks of the last BMA strike action. The point that I've been trying to make this week really is that I feel as though the British Medical Association, its supporters and its members are at risk of overplaying their hand. Now, of course, they do have public support. Many people think that doctors deserve more pay. And, to be fair to them, they have seen a real terms cut in their pay over the last 13 or 14 years. However, they keep pushing out this £14 an hour number, which is extremely misleading, given that junior doctors have a starting salary which is above the national average. They actually get paid around a third more than that starting basic salary in extra payments. Of course, it costs the taxpayer around £200,000 to train a doctor, which you wouldn't say about other workers in our economy who are on £14 an hour, such as bartenders and baristas. And the really crucial point is the fact that doctors get excessively generous defined benefit pensions with employer contributions around 3 times that workers in the private sector get. So in addition
Annabel,
to
it's
having
very interesting
Yes.
there that senior doctors seem to be giving advice to junior doctors that actually the demand of 35% was naive and childish and probably unachievable. What were they doing that for? And they did say, coming back to your point about pensions, if you want your pay rise, give up those that highly generous pension scheme. So does reality have to hit these junior doctors in what they're wanting as a pay rise? Because I think the popularity with the country, will fall when they realise the amounts they're being paid.
Yes, I mean, 35% is obviously absolutely massive. It's over 3 times the current inflation rate. As Steve Barclay, the Health Secretary, pointed out at the weekend, it is widely out of step with the pay increases that are being offered to other public sector workers. And for some doctors, it may amount to as much as £20,000 a year. This is more than some people will earn, in a year on a typical income. So, I do think that they're asking for too much. It does feed into this idea that they're overplaying their hand. They remain very quiet on public sector pensions, although the BMA has been forced to come out now and say that in suggesting doctors perhaps get a pay increase now for less jam tomorrow, less money in their public sector pensions.
Denham, thank you very much indeed for your insight into this.